After discussing the adenocarcinoma of the stomach or gastric adenocarcinoma, which is about 85% of the cancers of the stomach, we will talk about in this section about less common type of gastric carcinomas. So less common type of gastric cancers, which constitute about 15% of the gastric cancers, are the lymphomas we have and the sarcomas, non-lymphoid sarcomas, lymphomas and sarcomas. And then what's the clinical features of the lymphomas and how we treat, all this we will talk about in this section. So primary gastric lymphoma. Primary gastric lymphoma account for about less than 15% of gastric malignancies. 2% of all lymphomas. So 2% of all lymphomas in the body are gastric lymphomas. But if we talk about only the gastric cancers, it is about less than 15% of all the gastric malignancies, because we already mentioned that 85% are the adenocarcinomas. This is the picture of the gastric lymphomas. Gastric lymphomas. Lesions of lymphomas is present in the corpus or the antrum. Diagnosis is by the radiographs, endoscopy or biopsy, cytologic brushings, and by the gastroscopy or laparotomy. All these are the different diagnostic procedures that help in the diagnosis of gastric lymphomas. And again, biopsy and cytological brushing or examination is very, very helpful in the diagnosis. But we can also, and these are done by gastroscopy and laparotomy. So these are the different diagnostic tests for the lymphomas. So the clinical features of the gastric lymphomas and gastric sarcomas. We already said that the adenocarcinomas are the most common type of gastric carcinomas. And as the name shows, adenocarcinomas are from the stomach glandular tissues. Adeno is for the glands. Then the lymphomas are from the lymphatic tissues or lymph nodes of the stomach, mainly the lymphatic tissues. And then sarcomas are from the smooth muscle tissues. So all these are the different tissues which involved in these different types of the carcinomas. And adenocarcinoma is 85%, and less than 15% or 15% are together we have lymphomas and the sarcomas. Features associated with the carcinomas or gastric sarcomas and lymphomas, as they are the cancers or the growth, so the clinical features are the same as with any other cancer or the growth. Epigastric pain is one very important feature, especially when the cancer is starting invading the tissues and become ulcerative type. So epigastric pain is in the upper middle quadrant of the abdomen. This is the picture that tells that the patient is in very bad pain. Epigastric pain is present. Then the early satiety, when the patient eats, the ability of the stomach and the ability to distend the wall of the stomach is affected. So they feel early satiety, which is the early feeling of the fullness is present, that they feel that they are heavy and full and they cannot eat any further. That's early satiety. Then there is fatigue as a result of all poor eating, pain. Patients do not want to eat well because they are in bad condition, they are having pain and they have early satiety. All these can lead to the fatigue and weight loss. Acute or sudden type of weight loss is there, because there, if you notice that the patient is losing weight suddenly and they are fatigued, they make sure you should pay attention to that. And ulcerations are present also. That is another factor that can lead to the epigastric pain, which is the site of the location of the stomach. So all these are the important clinical features associated with the lymphomas of the stomach. Treatment is the antibiotic treatment for the cancer. Usually antibiotic treatment is not very effective or helpful, but as I mentioned before, some infections, especially H. pylori infection, is important factor that cause disorders of the upper GI tract or the stomach especially. So antibiotic treatment helps to relieve that infections and let the patient feels better. Surgery is another important treatment option, and it can be a total, subtotal gastrectomies depending on the spread of the cancer and the site. Radiation therapy, as with any cancer, radiation therapy is also helpful in this. And then depending on the size and the staging of the tumor, the treatment options vary. Sometimes the radiation and chemotherapy are the first steps of management, followed by the surgery, and which can regress the tumor, and then surgeries are easily performed. Then we have chemotherapy also done for the treatment of the lymphomas. Subtotal gastrectomy, or the partial removal of the stomach to remove the cancerous site or to remove the area affected by the cancer so it cannot spread to the different parts of the body. Gastric non-lymphoid sarcoma. It's non-lymphoid, and sarcoma, oma is the tumor, sarco is for the smooth muscle tissue. So this is the tumor that develops in the smooth muscle, sarcomas. Mostly leiomyosarcoma. Myo is for the muscle, leiomyosarcomas, and gastrointestinal stromal tissues, stroma. In gastric fundus or the fundus of the stomach is the top part of the stomach. It is present in the gastric fundus. This type of tumor or sarcomas, they rarely invade the viscera. So they do not invade the viscera or other structures or the other organs present in the abdominal cavity. GISTS type of the sarcomas, they are unresponsive to chemotherapy. So other treatment options should be tried for the treatment of GISTS besides the chemotherapy, like radiotherapy and the surgical options. Treatment are surgical resection of the tumor. Then we have imatinib mesylate is another treatment option, and also sunitinib or regorafenib can be tried. So this was all about the section 3 of our lecture. Thank you for watching sqadia.com.